Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's January 29th, and we have a lot to talk about. I'm back from a meeting of the Progressive MS Alliance where we spent a full day exploring how to best align and broaden patient engagement in MS research and particularly in the development of new MS drug therapies. And personally, it was so gratifying to hear one expert after another talk about the value and the importance of including the voice of people living with MS in all phases of MS research, starting with the earliest planning and defining the goals of a research project. Well, you can expect to hear much more about the growing interest in and importance of patient engagement and patient-reported outcomes in the coming months and years. These are concepts that are having a huge impact on the medical research community. You know, one of the fundamental questions on the minds of just about everyone living with multiple sclerosis is, how did I get it? What causes MS? It's a question that's still awaiting a definitive answer, but as we wait for that answer, science is uncovering more and more information about MS risk factors, the things that can make living with MS better or worse. And many of these risk factors amount to choices. They're decisions that we make that can worsen or ease the burden of living with MS. My guest today is Dr. Farren Briggs, an epidemiologist who's focused on the etiology or the cause of multiple sclerosis and the risk factors that actually impact the course of the disease for an individual. But before we get to my conversation with Dr. Briggs, there are a few other things that you should know about. Almost as important as understanding how or why someone gets MS is understanding how the disease might progress. And a European research team has published a small study that was designed to determine whether physical disability and cognitive decline could be accurately predicted among people living with MS. So the study involved 115 people living with multiple sclerosis who were initially diagnosed and then followed up after 2 years and 6 years. In addition, 79 of these patients were followed up after 12 years. The research team looked at MRI images at diagnosis, and then 2, 6, and for some study participants, 12 years later. And cognition was measured at the 6-year follow-up using standard neuropsychological testing. Well, the result of the study indicates that the patients with early signs of neurodegeneration and a baseline diagnosis of primary progressive MS were more prone to develop both disability progression and cognitive dysfunction. And when it came to predicting cognitive dysfunction, some of the predictors included whether the patient was male, what their level of education was, and a higher baseline T1 lesion volume. And if you'd like to review the study itself, I'll include a link in today's show notes. If you've listened to past episodes of Real Talk MS, you've probably heard me rant about the important difference between facts and beliefs. When it comes to science, like the MS research that we talk about on the podcast, a fact is something that can be proven through direct evidence. That's why I talk about clinical trial results. These objective results are arrived at through a transparent scientific process. Now, a belief might be something that, based upon your own life experience, you hold to be true. For instance, there are a lot of people who have strongly held beliefs that one particular diet or another can slow MS progression and even reverse its effects. In fact, just last week, someone was sharing information on social media that a specific diet could actually erase lesions in the brain and cure MS. Now, I never want to cast doubt on anyone's personal experience, but we don't always know why or under what circumstances someone's personal experience may have occurred. And what makes it even trickier is that most people living with MS experience remission. And a remission can last for many years, so some people are free to assume that one specific thing or another that they may have done may be responsible for their remission. And if that remission is long enough, well, sure, it starts to feel like a cure. So the challenge lies in taking these anecdotal experiences and attempting to duplicate them under rigorous scientific conditions to produce a measurable result, a result that can be duplicated over and over again with confidence. And when it comes to the subject of how diet impacts MS, well, we're not quite there yet. In fact, a research team set out to assess the diet advice for managing MS that was available on the internet. Now, their research took place in November 2016, and the method was pretty straightforward. Using the search term MS diet, the researchers ran searches on Google, Yahoo, and Bing. The first 2 pages of results from each search engine were used for this assessment. Duplicate page links were removed, and the data extracted from each website that the researchers visited included the specific advice relating to diet and its rationale, and the citation of supporting scientific evidence. They also looked at the specific credentials for the authors of the web page content to further assess the quality of the information. Well, the study results indicate that 32 web pages were finally assessed. These web pages made a wide variety of specific recommendations regarding diet as a tool for managing MS. The most common diet recommended was a low-fat, high-fiber balanced diet, followed by a low-saturated fat diet, the mostly vegetarian swank diet, and the paleo diet. Individual foods or nutrients that were recommended to be included in your diet included omega-3 and vitamin D supplements, fruits, vegetables, and lean protein. And specific foods that were recommended to be removed from your diet, well, they included saturated fats, dairy, gluten, and refined sugar. And while all of these recommendations were accompanied by a rationale relating to how these foods or these diets would impact the development, prevalence, or symptoms of multiple sclerosis, now I'm quoting directly from the study, quote, "However, very little of this information is supported by the scientific evidence between diet and MS." And the research team concludes, again, I'll quote directly from their study, quote, "There is a wide variety of web-based dietary advice, which in some cases is contradictory. In most cases, this advice is the result of people's individual experiences and has not been scientifically tested. How people living with MS use this information is not known. These findings highlight the important role health professionals can play in assisting people living with MS in their health information-seeking behaviors." In other words, they found a lot of well-meaning individuals sharing their beliefs and miscategorizing those beliefs as facts. And the majority of these individuals chose to remain anonymous. Of the 32 web pages assessed in the study, only 9 had authors who chose to identify themselves. Now, there are some facts that shouldn't be ignored. Eating a healthy diet is a smart lifestyle choice for everyone. That's a fact. We know that a healthy diet promotes better cardiovascular health for everyone. And it seems logical that avoiding excess weight, avoiding obesity, would make mobility easier for anyone, including people living with MS. but we still lack the clinical evidence to determine whether one particular diet or another has a specific impact on multiple sclerosis. And when we have that scientific evidence, well, I hope you know that I'll be among the first to be talking about it. If you'd like to check out this study, I'll include a link in the show notes. Last week, I told you about a study that demonstrated how mindfulness, or mindful meditation, was shown to be effective in improving overall well-being for people living with MS. Well, the results of another study seem to support this same concept. In this particular study, a research team in the UK measured the effectiveness of online relaxation training among people living with a variety of long-term neurological conditions, including brain injury, stroke, Parkinson's disease, and MS. The study participants accessed a 5-session relaxation training program plus a follow-up session from their homes. Their anxiety and depression levels were measured before they began the relaxation training program, after completing the program, and again 5 weeks later. And statistically significant improvements in both anxiety and depression were recorded following completion of the program, and at the follow-up assessment that was made 5 weeks after completing the program, the improvement in anxiety had been maintained, and there was further significant improvement in depression. And there was no increase in depression or anxiety in any of the participants at any stage of assessment in the study. And as I said last week when we were discussing the study that demonstrated that mindfulness was effective in managing depression, anxiety, and sleep problems among people living with MS, this type of treatment is affordable, it's easy to access, and it's easy to do. So this is more encouraging news of a non-pharmacological treatment for people living with MS who may be experiencing depression and anxiety. I'll include a link to the study in today's show notes. Roughly 2/3 of the people diagnosed with MS are women, most of whom were diagnosed between the ages of 20 and 40, which is the same age range that many women plan to have children. We also know that the sooner after diagnosis that someone begins disease-modifying therapy for MS, the better, because the longer you put off disease-modifying therapy, the greater the risk of increasing long-term disability. What isn't quite as clear to everyone living with MS is how these powerful disease-modifying therapies and even the medications used for MS symptom management might affect someone's plans to start a family. So the MS Trust in the UK convened a multidisciplinary working group made up of MS specialist nurses, neurologists, obstetricians, midwives, and people living with MS to develop a set of guidelines about pregnancy and multiple sclerosis. The guidelines bring together evidence from drug-specific pregnancy registries as well as published peer-review research, and they cover pre-pregnancy counseling, disease-modifying therapies for both men and women, MS management during pregnancy, delivery and anesthesia options, breastfeeding, and disease-modifying therapies following birth. The guidelines have been endorsed by the Association of British Neurologists, and you can find a link to these important guidelines in today's show notes. My guest on last week's podcast was Dr. Aaron Boster, the System Medical Chief for Neuroimmunology at Ohio Health. And Dr. Boster did just an amazing job breaking down the important differences between the two schools of thought when it comes to disease-modifying drug therapy, the induction therapy model and the escalation therapy model. And I thought that Dr. Boster made a very strong case for how important it is for someone living with MS to make sure that they have a conversation with their neurologist about how their neurologist is going to go about prescribing a particular disease-modifying therapy for them. And the key in that sentence is the word conversation. as in a two-way exchange of thoughts and ideas. Now, you'd think that this would be a given, but Dr. Boster explained why it isn't and why it's so important that you have that conversation with your neurologist. If you missed listening to last week's episode, I highly recommend that you find it and make the time to check it out. I think Dr. Boster discusses just a really important but often missing piece that should be a part of determining your MS treatment plan. And if you'd like one more reason why that conversation is so important, consider this research study that was published just last month. Researchers from several MS centers across the United States looked at patient adherence to MS disease-modifying drug therapy, and they found that adherence rates ranged anywhere from 49% up to 88%. Now, we already know, but it's worth repeating that starting disease-modifying therapy and staying on disease-modifying therapy improves your quality of life by slowing MS progression. Now, that doesn't necessarily mean that you won't have to change your disease-modifying therapy, but you should be on a disease-modifying drug. So low adherence rates mean higher levels of disease progression for more people. And what this research team discovered is that shared decision-making, that is, decision-making between a person living with MS and their neurologist, led to higher adherence rates to disease-modifying drug therapy. A proactive shared decision-making approach is one that takes into consideration the patient's preferences. It provides access to patient education so that a patient can make informed decisions. And it promotes patient engagement in determining a treatment plan. So at the end of the day, when a neurologist engages the patient and involves them in determining their treatment plan, that patient is more likely to stay on the plan. And that means that they're more likely to avoid the risks of not being on a disease-modifying therapy. So for the best possible outcome and the best quality of life, you want to make sure that your MS treatment plan is a result of shared decision-making between you and your neurologist. And you'll find a link to this study in today's show notes. No one really gets to choose whether they have MS or not, but some of our choices can influence the course of the disease. In a moment, we'll meet my guest, Dr. Farren Briggs, an epidemiologist who specializes in researching the cause of MS and identifying the risk factors that impact disease progression. One of the biggest questions that people living with MS have is, how did I get it? What causes MS? And as of today, we still don't know. Chances are pretty good that if you talk to 100 people who are living with MS, you'll probably come away with at least 100 different explanations that attempt to answer this fundamental question. You might hear that MS is caused by a particular virus, or that it was caused by an immunization, or an allergy, or dairy products, or GMOs and pesticides in your food, or where you were born, how much sunlight you've been exposed to, the amount of gluten and sugar in your diet, or a parasite that's invaded your system. I should probably mention that every one of these explanations has actually been proposed by someone living with MS. My guest today is Dr. Farren Briggs, an epidemiologist at Case Western Reserve University, and Dr. Briggs' research is focused on investigating the etiology or cause of multiple sclerosis. Welcome to the podcast, Dr. Briggs.
Good morning.
So maybe we can start with some vocabulary. Can you help us understand the difference between the etiology of MS and the risk factors of MS?
So etiology is the actual underlying biological process that leads to the initiation of MS. So what's the actual biological mechanism that becomes dysregulated somehow that leads to MS? And then risk factors are exposures or variables or genetic factors that predisposes someone. So these risk factors somehow interact with the underlying biological processes to initiate the onset of MS.
Oh, so putting aside some of those closely held beliefs that people may have about the etiology of MS, what do we know about it today?
Well, we know a lot. Actually, there's been a lot of progress in the last 2 decades, particularly. So, one, there is a very strong genetic component, and estimates right now are about 20 to 50% of the disease could be explained by genetic risk factors. However, these genetic risk factors only predispose to someone, so it's a combination of both your genome with your environmental exposures, with your lifestyle. And so to complement that, we have, as you mentioned in the introduction, many things have been associated with increasing the risk of MS. So lack of vitamin D, low levels of UV light, obesity predisposes you, smoking predisposes you, having a history of infectious mononucleosis, so having mono, stress, lower socioeconomic status. So we're seeing a whole increased collection of factors painting this very complex picture. But what we can say about what ties them all together is that all of these things can be described as pro-inflammatory exposures. So they all somehow interact with the immune system. And so inflammation is one very prominent component of MS. And the second component, which affects how the disease manifests, is neurodegeneration. So the ability of the body to repair itself and repair damaged myelin that surrounds neurons. So there's these two processes. And so we're starting to really uncover a lot about the inflammatory mechanisms that trigger the onset of MS.
So when you talk about some of the risk factors that can possibly impact or affect how MS develops, if it develops, and then what course it takes, it sounds like some of them really relate to what you might want to call lifestyle kinds of choices. Things like choosing not to smoke, choosing to eat a smart diet and not allow obesity to be a part of who you are. Those things seem to not only make sense for everybody out there, but even make more sense for people who are predisposed to MS for other genetic reasons. Am I getting that right?
You are 100% correct. What is fascinating, so yes, there is this genetic component. However, there have been several studies that have shown that the number of new cases of MS per year is actually increasing. And so we call that term incidence. The incidence of MS seems to be increasing in the last few decades. And so for the incidence to increase, that points to a strong role for lifestyle and environmental factors. So within one generation, genetic factors can't really increase incidence that much. And so we're seeing this really strong level of evidence suggesting these Western exposures, if you want to lump them together, these Western civilization exposures as increasing the risk for MS. And these are very pervasive common traits, right? So smoking, fortunately, smoking has decreased, but still we don't know the window that's relevant for how long did you need to have quit smoking for it to no longer be a risk factor. There's some evidence pointing to now the microbiome, particularly in the gut, and so that's the relationship with that and diet. And so it's really trying to start thinking about what are these modern day exposures that are increasing the incidence of MS. And so it's perplexing, but also just really trying to dive in. It's also an opportunity to dive into these specific inflammatory pathways that these common exposures might be dysregulating.
Beyond just perhaps increasing the incidence of MS, I'm wondering, do these same sort of, as you've appropriately characterized them, so many of them Western lifestyle factors, do they also play a role in the course that MS may take?
That's a great question. So the first part, we'll start with the genetic component. So to date, so far, they've identified just over 200 genetic risk factors, genetic variants associated with MS. None of those risk factors, genetic risk factors, are associated with any aspect of MS progression, except for earlier age of onset. They seem to, if you have the genetic risk factors, you may develop MS earlier. But it doesn't affect any other aspect of how it progresses. So whether you have primary progressive, relapsing or remitting, or how fast you go from relapsing remitting to secondary progressive, so forth. As for these other exposures now, we can go through them. Yes, smoking increases both how your transition from relapsing and remitting to secondary progressive. It seems to, work I've done, seems to increase disability in walking, maybe increase your levels of depression. There's also some evidence for obesity as well. Being of lower income as well seems to predispose you for worse outcomes. And so, yeah, we're seeing this overlap between these risk factors, these environmental risk factors, these exogenous risk factors, and how the disease manifests itself over time.
Well, that's a remarkable thing to really understand, in that, people are waiting anxiously for that next pharmacological breakthrough, where there's going to be a medication that's going to, in some way or other, help resolve some of their symptom issues. And yet it sounds like making some smart lifestyle choices can really help in, at least to some extent, from what I'm understanding, minimizing some of the impact of MS on you.
100%. And so, I remember once having a conversation with someone, a clinician, and he said, we already tell our patients not to smoke, so this is not interesting. And I was like, hold up. One, there are still individuals who keep smoking, so we need to be persistent with them, because this is identifying certain behavioral patterns that need key attention. It might also be a surrogate for patterns in taking medication, quality of life, and other things. But also, it's most interesting that we can look at smoking, because smoking is such a clear exposure. If we can understand the biological mechanism through which smoking increases risk and also influences progression, then we can start to identify potential drug targets that will then allow for us to develop novel therapeutics. And so here's the reason that we still need to look at smoking, even though, we all know it's bad. We don't know how. What's the process? Why is it bad? Is it because it increases oxidative stress? Does it introduce DNA damage? Is it through nitric oxide? Well, we're not sure yet. And so this is where a lot of my work I would like to keep going in that direction, to really piece it apart so that we can hopefully uncover opportunities for developing drug targets.
The work sounds fascinating. It's certainly really important. And I appreciate you taking a few minutes today to help walk us through how some of these risk factors come to affect whether someone is going to be diagnosed with MS, and then the fact that they even have some choice in terms of lifestyle in helping to influence how MS is going to impact them throughout their lives. Thanks so much for taking the time to talk with me today, Dr. Briggs.
Thank you for the opportunity.
That's going to wrap up this episode of Real Talk MS. Just a reminder that your feedback, questions, and suggestions for future podcast episodes are important to me. That's why, in addition to emailing me at john@realtalkms.com, and that's JON@realtalkms.com, well, now you can also call a special listener hotline that I set up specifically to capture your comments and suggestions. Just call area code 310-526-2283 in the United States and share your thoughts. So whether you choose to shoot me an email or make a phone call, I hope you'll get in touch and add your voice to our conversation. My name is John Strum. Thanks for listening, and we'll catch you next time.